everyone. Happy Monday to you. It is the beginning of your week, and what that means for you is you're in for a treat. I sit here with Dr. Murphy. He gets asked a question. He decides if it is a myth or if it is fact, and then you end up having the best week of your life because you're better for knowing this information. Right?
Mm-hmm.
Okay, your question is this. Is it true, Dr. Murphy, that if you have a mild to moderate fever, that you should let it run its course and not take medicine because it's your body's way of fighting off infection? Is that true, or is that
true?
Is it really? Is it one of those things that may be true sometimes and not true other times?
Nope.
Is it 100% true all the time? When is a fever something that you should be worried about and take medicine for?
Don't really worry about fevers too much in adults. They're more of a problem in children because they can have febrile seizures.
Yeah.
They overheat. The body can't get rid of the heat quick enough. So typically in infants, we've all heard of people that have had febrile seizures. That's just the body's way of shutting down to respond to the fever.
Okay.
But as a rule, fevers are good when you're sick because your body's revved up, its immune system's in overdrive. The bacteria and viruses do not grow at a higher temperature. So this is all good to fight an infection.
So it's kind of like whenever your computer is trying to do an update and it's getting so hot and the fans are spinning. That's kind of what's happening in your body.
Don't know about that one.
You know how your computer starts making noise, it's working in overdrive?
When those computers that blow up on the airplanes and cause a fire, I don't know if that's such a good thing. So
there were? When was that?
You got to read about them.
Read about it?
Yeah.
Where?
Well, iPhones and stuff, or Androids.
That was. Were you talking about those Galaxy phones a long time ago?
Whatever the hell they are.
Oh, he's talking about something that happened an entire
there's been some
decade
laptops.
ago.
No, there's been some laptops that have caught on fire from the batteries. They're lithium-ion batteries. They get exposed to water, get opened up, they'll catch fire.
They'll blow up.
Yeah. But no, that's not the kind of fever we're looking for.
Okay, so ultimately, now are there any types of situations where it's like, well, it depends. If it's just a fever, that's one thing. If it's a fever and then a million other things going on and certain types of illness or your...
No, I think fevers as a whole, it's not low grade. Don't worry about it. It's good. But if you're uncomfortable, take something for it.
Okay, that's it. Then nothing else going on. If other things are going on, should they be concerned? Like they're starting to not be able to breathe well, or maybe they're having congestion.
Yeah, but we're just talking fever, not anything else.
Just fever, that's the diagnosis is potentially it's fine.
But if it's a low grade fever, 100 degrees, don't worry about it.
Okay.
It's fine.
Cool. That's
it's beneficial to you.
So what's the number mark they should look for? Like if it's anything above 5 degrees higher than you normally run?
5 degrees higher, you're dying. No.
Well, then what is it? Because you said 2 up is probably fine.
I said what?
Because 98.6 is what it normally,
Sure.
Whatever that you normally run. Some people don't run 98.6.
No, fever of 100 degrees, 101, I'm okay with. 102.5, yeah, I'd be a little worried.
Getting a little dicey.
Anything higher than that, I get a little bit concerned about.
Okay. All right, well, I guess that's it then. So it is true.
It is true.
I wish we had a graphic that was like stamp. True. All right, well, pretend that you just saw a graphic and go on about your life.
I'm sure you'll fill one in.
All right, well, you guys have a great week, and we will see you tomorrow for either Trash Talk Tuesday or Doc Talk. We don't know yet.